Hello, in this mind map, we are going to look at the process of healing and repair. Now, healing occurs only after there has been tissue injury. So usually the reactions of the body to tissue injury would include inflammation, hemostasis with the formation of fibrin, as well as, of course, tissue destruction and tissue damage. Now, the process of healing generally can be divided into two major processes, one of which is repair and the other regeneration. So let's take a look at regeneration first. In regeneration, the cells and tissues actually grow back to replace lost structures. So in other words, the body is actually able to restore the original tissues, and in most instances, the functional status is preserved, so there's no significant functional loss. However, in contrast, when we're looking at repair, repair is actually an admixture of some degree of regeneration as well as organization. And we can define organization as conversion of inflammatory exudate into a fibrous scar. So in turn, what is a fibrous scar? So this is essentially where there is collagen synthesis and deposition, as well as deposition of extracellular matrix, or ECM. We will learn more about ECM later. So organization is synonymous with fibrous repair. Now, in contrast to regeneration, what happens is that the fibrous scar actually patches the lost tissue rather than replacing it with the original tissue. And therefore, as you can imagine, there will be some loss of function. Now, for both these processes, regeneration and repair, the ultimate endpoint would be what we call resolution, which basically means the cessation of inflammation. Now, what are some of the factors that affect regeneration versus repair? The tissue type is very important in this respect, so the type of tissue that is damaged or injured. For tissues that can regenerate, that heal by regeneration, they are usually labile tissues, or what we call continuously dividing cells. And examples would include epithelium, such as the skin squamous epithelium, stratified squamous epithelium in the epidermis of the skin, as well as columnar lined mucosa, for example, that which is lining the gastrointestinal tract. Another example would be hematopoietic tissue, such as that seen in the bone marrow. Now, these usually will regenerate because of the growth of stem cells. A second tissue type that is able to regenerate would be what we call stable tissues, and another name for this would be quiescent tissue. Examples would include liver as well as pancreas, and another example would be smooth muscle. So these tissues have a limited ability to regenerate, and the mechanism by which this is done is a little bit different. It is usually through growth factors, such as transforming growth factor, as well as hepatocyte growth factor in the liver, as well as cytokines. And you may be familiar with some of these, which were also which you would have encountered in inflammation, such as tumor necrosis factor, TNF, and interleukin. So this is actually not strictly pure regeneration. There is some degree of regeneration of the parenchyma, but at the same time, there is also compensatory hyperplasia. Now, in repair, the tissue type is different from those tissues that are seen in regeneration. So these usually involve tissues that are permanent. So these are, in effect, non-dividing tissues or non-dividing cells. And an example would be the heart muscle or cardiomyocytes, which is why after myocardial infarction, the heart actually heals by fibrosis rather than replacement of lost muscle. So here we actually have fibrous repair, so patching of the tissue rather than regeneration. So in the next mind map, we will look at the process of fibrous repair.